Become our student and get access to effective and free educational materials.
Good morning. What can I do for you?
Good morning. I have a bad cough, and I want to see an internist.
Do you have a registration card?
No, I don't. I'm a tourist.
Then you need to register as a new patient. Can I have a look at your ID card? I need your name, age, occupation, address and contacting number.
Here you are.
Thanks. Which kind of medicine do you prefer, Western medicine or traditional Chinese medicine?
I'd like to try traditional Chinese medicine. I heard it really works quite well if you know what you're doing.
All right, yes, he does. The registration fee is 7 yuan, please. Hello, so how are we feeling today?
Things are going well for me, Dr. Smith.
Am I correct in thinking that you are here for your annual physical?
Yes, I am applying for new health insurance, and I need a physical examination to qualify.
Your basic physical exam will include lungs, heart, blood levels, and eyes, ears, and nose.
I've been having a little trouble breathing. Would you look into that, please?
We can do an allergy test, and later I can send you for an asthma test.
I would appreciate it. When you give me a blood test, what are you looking for?
I am going to check your cholesterol, blood sugar, and white blood cell count.
I am expecting the tests to go well. I have been taking good care of myself.
Doctor, I feel much better now. Will I be able to go home sometime this week?
That's good to hear. You've had an ideal recovery from your operation. We're going to send you home tomorrow.
Do you think I can get back to work very soon?
Don't be in such a hurry. I'm confident that you'll be completely recovered in 4 to 6 weeks.
Is there anything I should do?
You'd better have a good rest for a week. Be sure to have regular meals. Stay away from alcohol. Give up smoking at least a little while.
Should I take some medicine?
Yes, I'm going to give you some. Take 1 tablet of this medicine 3 times a day before meals. For that one, 2 tablets. And remember to come to the outpatient department for a consultation in 2 weeks, please.
It's very kind of you.
You're welcome. We wish you a speedy recovery. Goodbye.
What seems to be the problem?
Oh, my God. It's my stomach. It's killing me.
Where does it hurt the most?
Right here. It hurts right here.
How long has it felt like this?
I felt okay when I woke up, and then, suddenly, I had this really sharp pain.
Do you have a history of stomach pain?
No, and I haven't done anything out of the ordinary.
Well, I think that we are going to have to get you to an emergency room right away.
Thank you for helping me.
Good afternoon, Chloe. I'm Dr. Evans. What seems to be the problem?
Hi, Dr. Evans. Thanks for seeing me on such short notice. When I woke up this morning, I had a really sore throat and a really bad cough. I think I am coming down with the flu.
Ah, I see. Yes, you do sound rather croaky. Well, let's have a look, shall we? Could you please open your mouth and say, ah?
Ah.
Good, yes, your tonsils are a little swollen and red. How are your ears, blocked at all?
A little actually. My sinuses are a little blocked up as well. I really feel terrible.
Okay, Chloe. Can you please breathe in and out slowly for me while I listen to your chest? You really are all bunged up. You don't sound too good at all. Okay. I'm going to set you up with a bunch of antibiotics. You will need to take these orange pills twice a day and these blue pills every evening. You will also have to take this cough medicine 3 times a day after meals. Finally, I am giving you an inhaler to use every time you feel breathless just to clear up your lungs.
Whoa, so many drugs. I hate swallowing pills. Am I able to go to work?
Absolutely not. You are highly contagious. You don't want to infect the rest of your coworkers, do you? I recommend staying in bed for at least 3 days and drinking plenty of fluids so you don't get weak and dehydrated. You can catch up on all the latest TV shows and movies.
Okay, would you mind writing me a doctor's note for work? Otherwise they may think I am faking it.
Ha ha. Sure, not a problem. Here you are. Now off you go and away to bed. If you have any questions, just give me a call. Feel better soon and take care.
Thanks, Doc. Bye.
Have you got anything for diarrhea?
Yes, here you are. These tablets are very effective.
How should I take this medicine?
Take 2 tablets every 6 hours.
I see. I'll follow your instructions.
And take a good rest for a few days.
Thank you. What seems to be the problem?
I have a really bad toothache. My cheek is swollen and I can't eat anything.
Let's have a look. This doesn't look too good. I think we may have to pull out your wisdom tooth. It's pressing against your molars, and that's one of the reasons you are experiencing so much pain.
When you pull my tooth, will you also have to extract the nerve and the root?
First, we will take some X-rays and see what we're dealing with. I also noticed a small cavity up front here, so you are going to need a filling.
I guess that's what I get for not flossing or brushing my teeth 3 times a day.
It could be that, or maybe you were eating too many sweets. In any case, I'll administer an anesthetic and you won't feel a thing. My toothache started nearly a month ago. The pain's been keeping me awake. Would you please have a look?
Open your mouth, please. Which one?
The one right at the back.
I'm afraid we can't save that one. It will have to come out.
Will it hurt much?
I'll give you an injection. Then you won't feel pain.
5 minutes later. Okay, it's all over. Spit there and bite the cotton ball tightly in place for half an hour. Well, what's the matter with you?
I've got a sore throat and my chest hurts.
Have you got a headache?
Yes, I ache all over.
Are you coughing much?
A little bit.
Now, let me listen to your chest. Ah, you have a temperature. Breathe deeply. That's right. Well, don't worry, it's only a throat infection. There's nothing wrong with your lungs. And how is your appetite?
It's gone completely.
Show me your tongue, please. All right, stay in bed and keep yourself warm. I'll prescribe some pills for you to take.
Is that all, doctor?
Yes, you'll be better in a few days, I'm sure.
Thank you, doctor. Goodbye.
Goodbye. Okay, doctor, tell it to me straight.
If you want to live much longer, you have to give up smoking.
I've tried before. Everything I've tried doesn't work.
Maybe with the choice of life or death before you, you will find it easier.
May I see that X-ray again?
See all these black areas? That's tar built up in your lungs.
And that is what's causing my shortness of breath.
Look at it this way. When you quit, you will save money, time and your life.
Good afternoon, sir. What can I do for you?
I'd like to get this prescription filled.
No problem. Please wait a minute. She goes to the back for a few minutes. Here is your medicine, sir. Take 2 tablets after each meal and once before bed.
Thanks. Do you sell aspirin here?
Yes, our over-the-counter medicine is over there on that shelf.
Oh, I see it. Do you have multivitamins?
Yes, right over here.
The customer gets the aspirin and vitamins. That'll be $16.
Here's a 20.
Here's your change. Thank you.
Hi, Mr. Smith. I'm Dr. Hawkins. Why are you here today?
I found it would be a good idea to get a checkup.
Yes, well, you haven't had one for 5 years. You should have one every year.
I know. I figure as long as there is nothing wrong, why go see the doctor?
Well, the best way to avoid serious illnesses is to find out about them early. So try to come at least once a year for your own good.
Okay.
Let me see here. Your eyes and ears look fine. Take a deep breath, please. Do you smoke, Mr. Smith?
Yes.
Smoking is the leading cause of lung cancer and heart disease, you know. You really should quit.
I've tried hundreds of times, but I just can't seem to kick the habit.
Well, we have classes and some medications that might help. I'll give you more information before you leave.
Okay, thanks, doctor. What's the matter with me, doctor? I feel so tired these days.
It's your blood pressure, I'm afraid. It's far too high.
And what's the cause of that?
Overwork amongst other things. You can't work 24 hours a day. You've got to slow down.
But I can't just slow down.
You've got to, I'm afraid. And look at this. You weigh 200 stones. That's too much for a man of your size.
You mean I've got to lose weight?
Yes. You've got to cut down on bread and potatoes and take more exercise.
Good morning. What seems to be the problem?
Good morning, doctor. I feel terrible. I've got a cold and I have a rash here on my neck. I'm not sleeping well either. What do you think the problem could be?
I'd say you've been working too hard or are under stress for some reason. Have you been taking anything for your cold?
Yes, I bought some medicine at the chemist's. I've been taking it for 3 days.
Good. I'm going to prescribe something stronger. It will make you feel drowsy, so you certainly should rest.
Okay, I can afford to take a few days off work.
Have you been working hard recently?
Yes, I have. I had to get a project finished. It's done now, so I can relax a little.
Good. Let's take a look at that rash. It looks worse than it is. I'm going to prescribe some ointment for it. If the rash doesn't clear up in a few days, come back and see me. Do you have any other sign?
I have a bad headache, but...
Don't worry about that. It's probably of the stress you've been under. Just take some aspirin. Combined with the stronger cough medicine, it will make you feel very tired. You shouldn't work or use in.
Thanks, doctor. I'll get these immediately. Goodbye.
Excuse me. My name is Dan Ford. I have an appointment with the dentist at 3:30.
Yes, Mr. Ford. The dentist will be ready to see you in a minute. Have a seat.
Thank you.
Dental clinic. This is Mr. Adams.
Hi, my name's David Johnson. I'd like to make an appointment.
All right, David. Is this for a checkup or a cleaning?
A checkup. I think I have a bad cavity. Half the side of my head hurts.
What tooth is giving you pain?
One of the back ones.
Let me see. We can see you this afternoon if you can come in at 4:30.
Our mission is to help you learn the English language. We have created easy-to-follow, free educational materials for those seeking knowledge of English.